Hello, my name is Dr. Geeta Maker-Clark, and I'm so deeply honored and grateful to receive the Health Award from Health and Medicine. Living and working in Chicago means you're surrounded constantly by activists who are doing grassroots work to community build and transform. And I feel very humbled to be among this incredible group of awardees today who are doing this kind of work. I met Dr. Quentin Young as an undergraduate 30 years ago at Northwestern University. I was immediately drawn to his message that to be a physician isn't just to care for the physical health of an individual, but to care for the health of all of society and to advocate for health care for all. My work is centered on that same principle that we cannot be healthy in an unjust society, that no one person can be healthy unless all of society is cared for. To that end, in my career, my integrative medicine practice is focused on root causes of disease with special attention to social justice, food, and nutrition insecurity. Without access to nutritious food, I don't believe that we can achieve the most basic aspects of health and healing. I want to express my heartfelt appreciation to my team at Endeavor Health Integrative Medicine and University of Chicago Pritzker School of Medicine for their commitment to integrating nutrition and holistic health into patient education, and that's been the cornerstone of our success. Together, we've seen the transformative power of food as medicine, which now has national backing and has grown as a movement. And it's not just about managing chronic disease as much as it is about empowering communities to reclaim health and well-being. I also want to acknowledge my family, my children, my parents, Vijay and Sushila, and my husband, Todd, who supports every radical idea that I have. I thank Dr. Audrey Stillerman and Erica Allen of Urban Growers Collective for nominating me, and let us keep pushing forward, united in our commitment to health justice.
Thank you so much, Health and Medicine, for this incredible honor. It means a ton to be recognized by a social justice giant. Margie, you and your team are inspiring and motivating. And thank you to the board, including Dr. Claudia Fegan and Dr. Joe Feinglass. Thank you to my dear Cook County Health colleagues, including Sarah Elder, Lydia Karch, Kathy Chan, Keiki Hanami, and county graduates Pam Ganschow and Bill Trick. You are brilliant in heart and mind, and thank you for this nomination. And thank you to my parents, Tom and Val, and my husband, Chad, and my children for being incredible examples and supports. Before coming to county, I used to work at the U.S. Department of Health and Human Services, and in the lobby of that building, there's a quote that I'll paraphrase, says, "The moral test of a government is how it treats those who are in the dawn of life, those who are in the twilight of life, and those in the shadows of life." For the last decade, it has been a tremendous privilege to be working as part of a team at Cook County to work on building systems of quality and compassionate care for persons who use drugs, especially those involved in the criminal legal system. Most of our patients live in the shadows of life. I'm so proud to be part of that team and a public servant. And thank you so much again, Health and Medicine, for this recognition, and congratulations to all those being recognized today.
Good evening, everyone. I'm really pleased to be here tonight. My name is Peter Sporn. I am deeply honored to receive the Medicine Award from HMPRG. I have tremendous respect for the organization and its founder, Quentin Young, a giant in the struggle for health justice, as well as other amazing health and medicine long-distance runners like Linda Murray, Claudia Fegan, Mildred Williamson, Tom Wilson, and others of you who I don't know as well. I'm also humbled to receive an award alongside this evening's other honorees, all of whom I know are doing incredibly important work. Over the course of my career, all of the health justice work I've done has been as part of a group. Thus, I want to acknowledge the colleagues I've worked with at Northwestern in pushing the institution to increase recruitment of people underrepresented in medicine to the medical school at all levels. I thank my colleagues in the Northwestern Sarcoidosis Program, the medical students I run with in Chicago Street Medicine, and my VA colleagues on the Jesse Brown for Black Lives Task Force. And critically important in this time of Israel's genocidal war on Gaza, I acknowledge my friends and comrades on the Jewish Voice for Peace Health Advisory Council, including Rachel Rubin, who is here tonight, and the many in Healthcare Workers for Palestine. Speaking of Gaza, tonight we must remember the more than 500 health professionals killed by the Israeli military and 300 others Israel has detained since October last year. At the same time, we should honor heroic Chicagoans like Bayer Ahmed, John Kaler, and Zahir Salul, who have risked their lives providing medical care to Palestinians in Gaza during the current war. Finally, I'd like to express my appreciation to my family and many friends who have supported me over the years. I especially thank my children, Jason and Asha, and most importantly, my wife and partner in all things, Barbara Ransby, herself a tireless long-distance social justice activist. Thank you again, and onward to everybody in this important work.
Thank you, Health and Medicine, for this incredible honor. In 2012, when I was in law school, I had the good fortune of hearing Dr. Audrey Stillerman, who many of you here tonight will know, speak about trauma and toxic stress. It was one of many light bulb moments for me and helped me think about how legal aid could be trauma sensitive. My first years of legal aid practice were filled with uncertainty and stress, but I found really meaningful support and encouragement from our monthly Illinois ACEs Response Collaborative meetings at Health and Medicine. Listening to Audrey, Marlita White, Elena Quintana, Pat Rush, and Margie Shops talk about racially just, trauma-sensitive work helped me stay centered and persistent in the application of those concepts to direct legal services and systemic work. 10 years into my practice, I see the wisdom of that work borne out every day. Not only working with amazing clients who are forced to navigate impossible bureaucracy just to maintain their rights, but importantly also with my colleagues as we co-create the healthiest legal aid agency we can. I'm grateful to Legal Counsel for Health Justice for allowing me to explore and collaborate beyond the typical structures of legal aid, and for being committed to policy work that is a direct result of individual cases. It's an honor to be recognized by Health and Medicine, a place and a group of people I revere and admire. I'd like to dedicate this award to my mom, Mary Hess, who has listened with empathy to every story of injustice and who has provided endless support to help me do this work. I'd also like to honor my dad, Fred Hess, and thank my family for being here tonight. Randy, Michelle, Ashley, Denise, and Mom, I love you.
Good evening, friends, family, and colleagues. I'm Arden Handler, and I'm excited to be here with all of you tonight to accept the 2024 Health and Medicine Research Award. I'm very grateful for this recognition, especially as I retire from the University of Illinois School of Public Health at the end of next month, which will be October 31st. I especially want to thank Gail Riedman for nominating me and to congratulate and thank all of my fellow awardees for your commitment and efforts to reducing health inequities. My first response when receiving the email about this award was, "What? Research? That's not me," even though I've been an academic for almost 40 years. This is because I do not think of myself as a researcher, but more of a systems change agent who collects and turns data into information for social change. I came to Chicago in January 1977 and was a student of Quentin Young, Jenny Knaus, and Lauren Crawford through the Urban Preceptorship Program. In 1985, I took a hiatus from my doctoral training at UIC School of Public Health and joined Health and Medicine and Leatrice Berman to develop an Illinois strategic plan to address racial inequities in infant mortality as part of the 9x90 initiative. I had a wonderful time in the small Health and Medicine office on State Street and wanted to particularly acknowledge all of my colleagues from that time, Leatrice, Erica Salem, Karen Peters, Michael Gelder, and Pat Terrell. More recently, I've had the pleasure of working with Health and Medicine board members Gail Riedman and Lon Berkeley on changing the birth center landscape in Illinois through the Illinois Birth Center Task Force as part of my co-leadership of the Illinois Maternal Health Task Force. A lot has been accomplished in Illinois over the last 5 years related to maternal health, and I look forward to continuing to work with all of you to use data and the results of research to fight for racial and social justice. Finally, I would be remiss in accepting any research award to not acknowledge my major research partners over the years, Deb Rosenberg, Kristen Rankin, and Rachel Kasky. My partnerships with these three amazing women have been fundamental to my success as a researcher. I also want to thank my family for allowing me to be a workaholic, and again, thanks to Health and Medicine for honoring me.
My name is Kara Murphy. I'm the president of the DuPage Health Coalition. To be acknowledged by your peers is the highest compliment. So on behalf of thousands of volunteers, partners, and the volunteers who make up the DuPage Health Coalition, I am so appreciative of this recognition. We applaud and share Health and Medicine's mission and vision for a socially just and equitable Illinois. At DHC, we ground our work in the collective belief that every one of our neighbors deserves high-quality, comprehensive care delivered in ways that are sensitive to their unique needs. DHC is led by a board representing key healthcare stakeholders across DuPage. In accepting this award, I want to speak to, and paradoxically also speak on behalf of, those partners. We couldn't accomplish a fraction of our work without the cooperation of so many. That list includes Northwestern Medicine, Endeavor Health, UChicago Advent Health, Advocate Healthcare, Access Community Health Network, DNA Healthcare, Juleigh Health and Care, DuPage County Health Department, and so many others. Thank you to each of them for the care and funding they provide and for their leadership in this collaborative effort. And on their behalf, a second round of thanks from them for this award. DHC improves health equity by marshaling existing assets and investing in innovative and targeted interventions. We coordinate comprehensive health access at a cost of less than $1 per patient per day by using careful financial stewardship and the volunteerism and donated care provided by each of our partners. We fundraise to help families purchase the high-quality health insurance for which they qualify. We build partnerships to open doors to preventative fitness and wellness. But in each of these partnerships, health equity is the driving aim, but partnership is the fuel. Health and Medicine, thank you for being such an incredible partner to all of us in advancing health justice in Illinois. We are so grateful for you, and we're so grateful for this honor.
Hello, my name is Sara Izquierdo. I'm the founder and one of the executive directors of the Mobile Migrant Health Team, here on behalf of our organization to accept this wonderful award from Health and Medicine. The Mobile Migrant Health Team is a specialized healthcare initiative here in the city of Chicago, founded by first-year medical students in an effort to provide culturally sensitive and language concordant health assessments to recently arrived immigrant populations and unhoused Americans. With my classmates and myself as first-year medical students, we were able to build this group with the support of wonderful attending physicians like Dr. Evelyn Figueroa. And in all honesty, if everything were well in the world of healthcare, of emergency response, and society in general, the Mobile Migrant Health Team probably should not exist. However, we exist out of necessity. We exist because we responded in order to bridge gaps in healthcare access and connection for people staying in police stations, in public park district auditoriums, and in other transient forms of housing during the migrant crisis. Since April of last year, we've been able to see over 10,000 people. My classmates, my colleagues, my friends, our mentors have found ourselves in clinics and hospitals, in emergency department waiting rooms with our patients. And as young people, we've discovered through these experiences firsthand the power of advocacy and uplifting and centering the voices of our patient population. We will continue to work hard and advocate for our patients. We will continue to progress towards healthcare equity as future physicians, and we will continue to make sure that social justice is at the center of medicine. De parte del equipo de Mobile Migrant Health Team, quiero agradecer a Health and Medicine por este honor tan grande que nos han ofrecido y por reconocer el valor en nuestro trabajo y el valor en apoyar, proteger y luchar para nuestros pacientes, para la justicia social y para la igualdad en el mundo de la salud. Muchísimas gracias.
Good evening. My name is Anthony Douglas. I'm a general surgery resident at the University of Chicago. Thank you, Health and Medicine, for the honor of the Emerging Leader Award. As a surgical resident at the University of Chicago, serving primarily the south side of Chicago, we become accustomed to seeing healthcare disparities up close. Gun violence is one of the earliest manifestations of inequities in the social determinants of health and healthcare disparities. In my 4 years of being a practicing physician, I've pronounced more human beings dead from gun injuries and gun violence than I can remember, many of them sharing my skin complexion. From infants to elders, the victims span the gamut of age and gender demographics. I must disclose the work that I've done and the charges that I've led have been selfish in intent. It is for self-preservation. Seeing the premature morbidity and mortality has taken a toll on myself and many of my colleagues. In response, I've created the first surgical advocacy fellowship, providing early career surgical trainees with the skills and the tools to become powerful advocates for their patients, both locally and nationally. Many of the surgeon advocates that I admire have acquired these skills by necessity later on in their career, but I imagine what we can accomplish if surgeons felt empowered to use their voices as they use their scalpels. After 1 year through the fellowship, I've completed 10 trips to both Springfield, Illinois and Washington, D.C., meeting with legislators on issues like gun violence prevention, prescription drug affordability, Medicaid and Medicare reimbursement, and other issues as well. In an effort to address the causes of gun violence, I started a non-for-profit called Little Scholars, an upstream intervention to prevent gun injury and death through 1st and 4th grade literacy. We just finished our first summer, and our children at the Southside YMCA have read 50 books each this summer. We're currently recording our 4th season of the Deep Cuts podcast, shedding light on disparities in surgical care and solutions to address them. Please rate and subscribe. I want to give thanks to my Heavenly Father, my parents, Anthony and Rachel Douglas, who are here with me today. Hi, Mom and Dad. Citizens Action Illinois for entrusting me with their interests and their projects. Dr. Selwyn Rogers, Jeff Matthews, and Andrew Benjamin for their undying support and belief in me. And thank you again, Health and Medicine, for this prestigious award.
Good evening, everyone. I am deeply humbled and grateful to receive the 2024 Emerging Leader Award. Reflecting on my journey, I am reminded of the humble beginnings that I had and how they have shaped my career path. From serving in my church and in other community settings to becoming a national advocate for ovarian cancer and now hospice, each step has been a testament to my passion for people and my commitment to advancing crucial causes. I am particularly thankful to Dr. Venantia Bate-Ambrouche for interviewing me and ultimately hiring me. And her guidance has been instrumental in propelling me to the next level of my journey. The support and the encouragement from my remarkable coworker, Maureen Burns. I want to thank my boss, Kim Downing. I want to thank Noel. I want to thank Joe for their invaluable leadership and service. But also, I've learned so much from the incredible Black women that have taken and advocated for health justice and equity. Their work is more important than ever, especially given the current state of our country. I think it's essential to keep the well-being of Black and Brown communities at the forefront of our efforts. Thank you to Health and Medicine for this recognition. Your support, acknowledgement mean the world to me. I am truly honored to continue to share in the mission of advancing health equity and justice. Thank you for believing in the support that myself and that all of us do. Thank you.
I am Brenda Battle, Senior Vice President for Community Health Transformation and Chief Equity Officer for the University of Chicago Medicine. I'd like to thank Health and Medicine for honoring me with the Lifetime Achievement Award. I'd also like to thank Rachel Reichland for nominating me. It is indeed a great pleasure to follow in the footsteps of so many leaders who have received this award in the past for their incredibly impactful work. It is of particular importance to me to receive this award from Health and Medicine, as you've been the long-standing champion of health equity and justice for so many populations over the past 43 years. Many pathways to justice and equity have been achieved because of your commitment to addressing the root causes of structural inequities. As a child of a pastor who was an activist and organizer of faith leaders, community members, and civic leaders, advocating for the rights of marginalized persons, I recognized pretty early on my responsibility to advocate for justice. I was taught through scripture and by example that as a citizen of this world, it is my responsibility to pursue equity and justice for all. Over a 43-year-long amazing career in multiple sectors of healthcare, I have made it my mission to live up to my calling by ensuring that every space I've had the privilege to serve in was one where I advocated for justice and equity. Whether as a practicing nurse, a corporate leader, a leader in community and government affairs, DEI, or whether transforming systems to create access to care and reduce health disparities, I view it as a privilege to own the responsibility to serve as an advocate for justice and equity for all. Congratulations to my colleagues who are receiving awards today. It is an honor to share the stage with you. Thank you to Health and Medicine for this honor.